Will democracy survive the next couple of years?
Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, The Answer Company. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now, in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence, with innovative procedures and expertise for the most advanced eye care.
Welcome back to Access to Democracy. And Alan Miller with you as usual. We have a return guest today. Interesting because he has been with us as a medical doctor, and he has been with us as a state senator, Dr. Scott Jensen, who is now with us as a candidate for governor. And Scott, welcome back.
Thank you, Alan. It's good to be with you.
Much to talk about. Now, as a candidate for governor, which party are you going to be seeking the nomination of?
The Republican Party.
I wondered about that because when you were in the legislature, there were a number of Republicans who were not happy with you because you didn't hold the party line. And that's something that doesn't seem to be tolerated very well these days in either party. But yeah, I mean, you were very active in the emergency insulin program and advocating it for the legalization of cannabis at least several years ago. Gun regulation was certainly a no-no for the Republicans. And you also favored a public health insurance option. So guaranteed to make you enemies in your own party. Have any of those things changed?
I think that because of the path we're on and with COVID-19, I think I've been sort of put front and center in the eyes of many people. And I've been given a chance to talk about the issues and, if you will, try to develop common ground with lots of folks and also clarify issues. I think sometimes in the legislature, if you have the audacity to talk about something, you'll be punished for it. And I'm trying to work through that because I have been willing to, if you will, be the maverick. And yet, on the other hand, I don't feel like I've in any way compromised my core convictions. Frankly, we have too many people in the Democratic Party playing down at the 5-yard line. And we have too many people in the Republican Party playing down at the 5-yard line. There's an awful lot of Minnesotans that would prefer to see both parties play between the 30 or 40-yard lines so that we can at least see one another, have conversations, and try to find solutions rather than just the partisan bickering and rhetoric. And so I find myself in a unique position, Alan, where I'm being asked, help me understand why you did that. What was your belief? What were you willing to do? And on the one hand, it's gratifying. On the other hand, it's a lot of work.
Well, do you see any opposition in seeking the Republican nomination at this point? I know Representative Stauber said that he's out. So I wonder, has anybody else come forward?
Mike Murphy is a gentleman I've not met. He's the mayor of a smaller town in the northern part of the Twin Cities area. I think perhaps Lexington, Minnesota. And he has put his hat in the ring, I think, for the Republican nomination. I'm not certain if he's what his specific goals are. I've not had a chance to meet him. But I think there will be others. I think there will be several people throwing their hat in the ring. You
have one piece of campaign literature out on television that I saw that is a very impressive piece, obviously done professionally and very well put together. I assume you're going to have more as we go into this thing with a primary coming up even before the general election, obviously.
Yes, I think, are you referring, Alan, to our launch video?
Yes.
Yes. Yeah, we worked hard on that. I believe that what we're seeing right now is an unsustainable path for Minnesota. And I think that many Minnesotans don't feel like they're being listened to. So what we tried to do in that launch video was create a sharp contrast between what we've seen happen and what we would see if I were governor. The emergency powers would be a terrific example. Emergency powers were never intended to be a tool of leverage by which you could move the legislature toward you in regards to your budget requests. And yes,
I saw some of your remarks about self-appointed emergency powers. And in fact, one of the questions that was going to be one of my first questions is why you, as opposed to Governor Walz, assuming he's running again, what would be different? What would you bring to the state? And I will say about those emergency powers is that I know you oppose them, but the court sustained them time and again. So obviously it was within his province to do that.
I think that we've seen emergency powers utilized around the nation. And in states that have a conservative leaning court like Wisconsin, the emergency powers have in many situations been removed from the governor. Minnesota has a liberal leaning Supreme Court, so Governor Walz has benefited from that. I believe that the emergency powers clause in our statutes is poorly written, and Governor Walz has taken advantage of that. One of the first orders of business for me would be to rewrite them so that there's a balance between the three branches of government. We do our best work, I think, when the legislature vets, discusses, debates, and does its homework on legislation. We utilize the judiciary branch to provide us with the wisdom to make certain that we're doing things that are constitutionally lawful. And then we move it to the governor for either his signature or his veto. We're not doing that with emergency powers now. And the fact of the matter is, the emergency powers and many of the executive orders have addressed things that were clearly not emergencies. But because those emergency powers had been, if you will, retained and used for so many.
You seem to be freezing up there.
Spending billions of dollars that the federal.
Yeah, you froze up there for a minute, okay. But not the first candidate who's been interviewed by me who's frozen up, but not necessarily on Zoom, which we're all living with. Let's talk about the elephant in the room. You first came out with the COVID vaccine analysis that it's a mild 4-day respiratory ailment. Where do you stand on that today?
You're asking about the COVID viral disease, not any vaccine here. I don't know if you said that.
Excuse me.
So you're talking. Yeah, I think in the initial, our first case of COVID-19 documented in Minnesota, I think it was March 6, 2020. And in the days and weeks and even months following that, we had national leaders such as Dr. Fauci and many others comparing COVID-19 to influenza, to a bad flu. I also made the statement that it had the symptoms of a bad flu. 3 to 5 days. Many people didn't even know they had it. Often people, when I had it, I had 3 to 5 days of what I thought were my ragweed allergies kicking up. My wife, who has fairly severe asthma, she had symptoms for 2 to 4 days that were more consistent with a cold or an upper respiratory infection. So yes, I did say that in terms of the context of what does COVID-19 as a disease look like, it looks like a bad flu. Now, having said that, we've never really had the kind of media coverage each flu season that we did with COVID, because every year with influenza, we have people die. In 2018, we had 80,000 people die in this nation. So I think that people really didn't realize how severe influenza could be. So I think people sort of compared my statements regarding influenza as me trivializing it like it was a common cold. The influenza is not a common cold. A common cold is caused by rhinovirus or maybe one of the other coronaviruses. Influenza is a serious disease, and that's why we have an influenza vaccination program available every year to people who choose to utilize it. But COVID-19, as a single-stranded RNA respiratory virus, mimics most closely influenza. It certainly doesn't mimic Ebola. It doesn't mimic, it doesn't even act like SARS coronavirus 1 in 2002. So yes, I did say that.
Yeah, and obviously, I assume you feel a little bit differently now with over 7,000 Minnesotans dead and 565,000 Americans and counting dead, as we seem to be going through a fourth surge at the present time.
Well, I think we have to look at the context, Alan. If we look at the 1918 pandemic, we saw far more deaths than we were seeing with COVID-19. So if you're going to compare those two pandemics, then you would say, yes, this does appear to be not as severe as the 1918 pandemic, which
except that we've had really miracle work with vaccines now that wasn't available in 1918, 104 years ago. And I think that marvelous work was done in getting these vaccines together. We have, much better facilities, much better instruments, medical instruments to do it. So I question whether that's a fair comparison.
And I would probably disagree with you, Alan, in that we have such wonderful vaccines for influenza. Actually, our influenza vaccines, as Mike Osterholm has said in the past, they're not, I think he said something about, it's not that good, but it's the best thing we have. I think, to your point, the difference between 1918 and 2020 has more to do with our ability to supplement oxygen and utilize antibiotics, because an awful lot of people in 1918 died of superimposed pneumonias on top of their influenza. But I wouldn't say that we've made such remarkable strides in regards to influenza because of the vaccine, because some of our influenza vaccine programs have proven in some years to be 10 to 15% effective, sometimes 30% effective, sometimes not even 10 to 15% effective. So I still think our influenza vaccination program is marginal at best compared to some of the things we do in medicine otherwise.
Now, you were actually on this interview from your office in Chaska, I take it.
Watertown.
Watertown.
Yes. Okay,
you've formed several clinics, and you've been practicing medicine for how many years?
40 years. 40 years ago, I graduated from medical school.
Not an immunologist or a virologist, but really, as you said, just somebody down in the trenches.
A big part of my practice focuses on probably cardiac disease, diabetes, infectious disease, mostly viral, antibiotics, antivirals. When I was in dental school, we studied public health and epidemiology. When I was in undergraduate, I studied the history of medicine and public health initiatives. How did we deal with the bubonic plague? So have I devoted my life to the study of epidemiology or virology? No. Do I engage every day with virology and infectious disease and antibiotics and antivirals? Yes.
Let's back up a second there. I heard something about dental school.
I was in dental school before I went to the seminary, which was before I went into medicine.
Oh, so there's a lot of this story here that we don't know. And you went into medicine, graduated, and how long ago did you start the clinics up there?
I practiced in two different practices from 1984 to 2000. During that time, I was awarded a Bush Fellowship. So I went back and studied skin disease and skin surgery and plastic surgery. And then in 2000, I decided to, frankly, Alan, I felt that healthcare was becoming too corporatized. And I feel like the best medicine is delivered when the patient is empowered and encouraged to be their own best champion, and the physician walks along at their side. I feel like we have more algorithms and productivity quotas affecting physicians and patients, as well as the electronic health record, which frequently the computer sometimes dominates the visit between the patient and doctor. So I said, I can't continue to do it this way. If I'm going to stay in medicine this way, I'm going to have to leave private practice. It was driving me crazy. So I left and I started my own clinic, and we don't use an electronic health record. We don't have a computer in the exam room with a patient and the provider. I just don't think that's the best kind of medicine. And frankly, I think that I would have probably retired from private practice a long time ago were it not for the fact that I've been blessed to be in a situation where I get to listen to my patients and I get to encourage them to make the decisions that they want to make. Because
Well, I have to say that's very refreshing in this day and age. But having the ability to bring up somebody's entire record through, IT, doesn't that help you?
Alan, I have had contests with some of my peers as to who can access information quicker. Me with my paper charts, they with their electronic health charts. I win every time. We are seeing a new kind of fraud in healthcare documentation today with the cutting and pasting. Medicare has come out and talked about this. Blue Cross, United Healthcare. These authorities, these third-party payers understand very clearly that frequently the visit that might have been done a year ago is simply being brought forward in an electronic health record, clipped into the new visit, even though the patient may never even have been touched by the physician. And patients have complained about that as well. So I'm willing to go with my paper charts for now, because clearly the electronic health record is not a perfected science.
That's an interesting take.
Alan, let me say one other thing. Where the electronic health record really works is where multiple parties want to use the chart at the same time. Where does that happen? In the hospital. It makes all the sense in the world for an electronic health record to take place in the hospital, where you may have a radiology procedure like a CAT scan being done at the same time the nursing staff is preparing on the floor to receive the patient back from radiology. You might have a surgeon looking to get ready for the surgeon next day. That's where the electronic health record really shines.
Now, among other things, where do you stand on face masks? I know you had a very different take on face masks for certainly early on. Where are you today on that?
I think the question of face masks or masking is clearly unsettled science. I think that if you look at all the data that we had from, say, 2000 to 2019, that data remarkably said masks did not provide any relief. That's why Dr. Fauci came out and Dr. Osterholm initially and said, you should not be wearing face masks. You should not be running around with face masks. Literally, we pivoted on face masks as a society and as a world in the month of April, May, or June. At that point in time, we had rapid fire sort of warp speed science generating data that said that the masks were really important. At that point in time, I said, fine, I'll wear a mask. Am I convinced that it's preventing disease in the vulnerable? I'm not. Might it help and mitigate? Yes. But if you actually look at the physics of the mask, and you look at the size of the COVID particle, and you look at the opening in the masks, and even the study that was done in Japan about 2 months ago that indicated that a mask would potentially filter 28 to 42% of the COVID particles. That would mean that still some 60% are getting through. So then the critical question becomes, what is the necessary viral load that a person needs to be exposed to in
Or is
order
it better
to
than nothing?
better than nothing kind of thing.
Yeah.
So that's why I think I've got my mask right behind me. But I think we're going to have to do more studies, because all the studies in 2000 to 2018 had pretty much been done on influenza viruses, which have a lot of comparison to COVID. But I think that right now, I think masks are being worn in some situations excessively. I don't think we should be masking high school students that are participating in sports. I don't think we should be masking kids under the age of 10. I think there's a lot for us to learn. I think the most important masking should be done for those people who are vulnerable. And frankly, we should be getting them better masks, better fitted, and they should be clean shaven, because we know that when a person has a beard, it compromises the ability of that mask to protect both the patient and the audience.
Goes right to my heart when you say that about beards. This one's been with me since 1966. I would hate to part with it. Now, yesterday, the CDC came out with a statement that pregnant women should safely get vaccinated against COVID. I know previously you had said to your patients, I think that they shouldn't if they were pregnant or planning on getting pregnant. Has that CDC report changed your mind in any way?
No. If you actually go back and look at the initial trials with Moderna and Pfizer, they did not include in their trials pregnant women. They excluded them specifically, along with kids under the age of 16 or 18, depending upon which vaccine you're looking at. The fact of the matter is, 4 big groups that were excluded from the initial discussions were pregnant women, children, people who had had COVID and resolved it, as well as sexually active women not using contraception. There was a tremendous fear that there might be a problem with the mRNA vaccines in a developing fetus. I don't think that's been settled. I understand that we have over 80,000 pregnant women vaccinated, and I hope everything goes well. But do I think that on a scientific basis we have it established? No. Dr. Paul Offit is arguably one of the most strong advocates of vaccines. He helped invent Rototec vaccine. And he has come out saying that he acknowledges the fact that with this vaccine being produced so rapidly, there are undoubtedly questions that are going to be answered only as we go forward. I just think that most women who are pregnant are under the age of 40, have few, if any, underlying medical problems. Why would we do that to them?
Well, I don't want to spend the whole interview, and I hope this is just the first of the times we get to interview you in the next few months, but I don't want to spend it on just medicine, because running for governor is a far more encompassing situation than medicine. What about Medicare for all, or seeing that insurance companies are out of the medical insurance business and that we have some sort of Medicare, Medicaid, universal insurance?
I have said for a long time, Alan, and I continue to believe this, I want all American citizens to have some basic package of coverage. It's critically important. It's gut-wrenching and heartbreaking for me to see a patient in my office with abdominal pain that I believe to be appendicitis, and I need to get a white count and a CAT scan and get them to surgery if I can, because if I can get that done before the appendix ruptures, typically we're sending patients home sometimes even the same day. The patient doesn't get sick, doesn't have to miss work, but oftentimes I've had patients say, "Doc, I don't have any insurance. I'm not going to the hospital. I'm not going to do this." I've heard or read that appendicitis can be treated with high-dose antibiotics. They used to do it during wars, during World War II. I'd rather go that way. That is not good medicine, and it's being driven by a lack of insurance. People are concerned they're going to have to remortgage their house, declare bankruptcy. We can do better than that. I still believe that. The mechanism by which we do it, Alan, I think we can continue to discuss. I think that there's pieces of Obamacare that, if you will, originated with both parties. The Republicans and Democrats had talked about some of those pieces for years prior to the formation of Obamacare. There are things we can glean from that effort and make it better. But the bottom line is, until we have every citizen able to be taken care of in emergency situations, I don't think we've done our job.
Well, a lot of Obamacare came from Mitt Romney in Massachusetts when he was governor, and that certainly would sustain what you just said. Now, infrastructure is a big problem here. I mean, we had a bridge fall into the Mississippi River. The Democrats propose a tremendous amount of money for infrastructure repair. The Republicans propose about 25% of that nationally. And it's similar in the state, except the Democrats have not been that generous, nor the Republicans, about 50% of the Democrats. Isn't that one of the big things that the next governor is going to face? Getting us up to speed, getting high-speed rail, getting all the things that we're lacking in terms of needs that'll make life easier for the populace?
That's a really solid question, Alan. And I would say this. If you're going to have an infrastructure bill that arguably has 10% of it going to actual infrastructure and the other 90% not, it's really not an infrastructure bill. It sounds to me like a mishmash omnibus bill. And both the feds and the states do that. I was in the Senate for 4 years and saw it happen every year. We would have a bonding bill, which arguably is supposed to be an infrastructure bill. And yet we would see all kinds of pork projects in there. So that's one of the problems. We need to stop doing these omnibus bills, do a pure infrastructure bill, and make sure that the populace knows who is voting for it and against it. But we're not seeing that. We're seeing this hodgepodge, mishmash, soup to nuts kind of thing. And it's really making it difficult for the public.
I see we are down to the last couple of minutes, but do you think that Biden legitimately was elected president?
I think that the results of the election, as reported, were verified through the courts in numerous states. And I think that I don't have any information that makes me privy to really doing an analysis, but I have to trust our courts.
And isn't it a better thing with as many people getting to the polls as possible, as opposed to throwing up restrictions to keep people from the polls?
I would disagree with you there. I think we want to make it as easy as possible to vote, but we want to make it as difficult as possible to cheat. So I think we need to balance both. We have to have secure elections, or we're not going to have a trusting public. And if we don't have a trusting public, we're in problems.
Using Minnesota as an example, of course, we have had solid elections without cheating. And as we look around the country, it's funny, I documented only 4 cases, and they all involve Republicans who cheated in this last presidential election, which I found kind of amusing because of what we're going through. In any event, we just have a few seconds left. And obviously, we hope to have you back. But do you have any message to our now expanding viewership as we're prepared to sign off?
I would love people to go to drscottjensen.com. That's my website. I want to represent Republicans, Democrats, independents, and all people in Minnesota. And the best way for people to get to know me is to go to my website, drscottjensen.com, and learn more about me and let me know what your questions are.
We've been talking with Dr. Scott Jensen, who has not only been in medicine, but in government, and is now seeking to run for governor of Minnesota. Scott, always a pleasure. And I think we'll probably both be chastised for dealing with each other, but it is a pleasure. And I hope to see you again as we head toward the election.
Thank you, Alan.
Thank you so much.